Good morning, everyone. My name is Alan Maleche. Welcome to this press conference about healthcare workers and level of preparedness specific to medical practitioners, pharmacists, and dentists. I want us to start in the next 2 minutes. We have a few people waiting to join, so we shall start at exactly 11:04. In the meantime, if you're not speaking, please mute your mic and also mute your camera so that we can ensure we have a good quality for conversation. We will start at exactly 11:04. Thank you all for joining, and I'll be in touch with you in a few minutes. So colleagues, as promised, let us start, and I'll introduce myself once again. For those who are not when we started, my name is Alan Maleche. I work with KELIN in the capacity of the Executive Director, and this morning I'm very pleased to have a chance to share a routine survey that was done in partnership with our trusted partners, Kenya Medical Practitioners and Dentists Union, around the healthcare workers' level of preparedness in response to COVID-19. We have been doing a series of this routine questions and discussions with healthcare workers. We began with clinical officers last week. We have done one yesterday with the nurses, and now today we're doing the third series with the members of KMPDU, and we will work through having a quick presentation from my colleague Alex Mudui, who led this process, and we'll have a reaction from Dr. Mwachonda, who was our liaison person from the union. We'll then open it up to colleagues from the media and anyone from either the Council of Governors or Ministry of Health, if they could respond to issues, and then we'll open it up to everyone else generally. So we hope to keep time and finish by 12:05. Feel free to also use the chat box to pose your questions. The slides will be made available about 2 hours after we finish the presentation, and this will be emailed to everyone. And the final reports, all three of them, the clinical officers, the nurses one, and the one from the doctors, dentists, and pharmacists, will also be made available before the end of the day to every stakeholder. So that's the plan of action. Let's just remember the usual etiquettes. Mute your mic if you're not speaking, mute your video if you're not speaking and you do not have use for it. And remember to put your questions in the chat box so that they can be captured early, and those who are presenting would be notified of them and they can respond. So for now, I quickly hand it over to my colleague, Alex Mudui. Alex, you have exactly 12 minutes to try and give us a quick summary and the highlights of what came out from the conversation with our colleagues in the medical profession, particularly the pharmacists, dentists, and medical practitioners. Over to you, Alex Mudui.
Thank you, Alan. Thank you, Alan, and good morning to all. So first of all, again, to acknowledge and to appreciate the efforts taken by the medical practitioners, pharmacists, and dentists who undertook this assessment with us, and also appreciating the leadership of KMPDU through leadership of Dr. Machonda for mobilizing and also ensuring that the assessment was a success. So I'll go briefly through what we found out from the assessment, and we were aiming just to determine the level of preparedness of healthcare workforce, particularly the medical practitioner, pharmacists, and dentists, to assess if they are well prepared in the context of occupational health and safety, looking at the environment and also the challenges that they've been facing and any concerns in regards to health perspective. So we were able to talk to a number of medical doctors, medical practitioners, pharmacists, and dentists. We were targeting 47 counties, though we were able to reach around 29. So generally, Kilifi and Mombasa is where we were able to engage most of the practitioners, the medical practitioners, at around 13%, 12.9 or roughly 13% each. So majority of the people we were able to engage with were, or the respondents were male at 59%, while female were at 41%. We also looked at in terms of the age group, so majority were of the age 31 to 35 years at 48%. Again, looking at the health facilities in terms of the type of health facilities, majority of the medical practitioners that we're able to talk to were coming from public health facilities at 94%. And specifically just looking at if the healthcare workforce, the medical practitioners, pharmacists, and dentists, if they've encountered any patient with COVID-19 symptoms, around 39% stated that they have encountered a patient that portrayed the symptoms or showed the symptoms of COVID-19. And this one, again, is just in cognizant that healthcare workforce or healthcare workers at the front line, they are the most at risk according to even previous surveys by WHO, which they put them at 21 to 32 times much riskier in terms of the exposure or contracting any disease during epidemic. So, and just from what we encountered, you can clearly see that almost 40% were able to, they have interacted with a patient who was shown symptoms. So again, we looked at if assessing if the cases were increasing or they were decreasing, and we found out actually that 7% of the medical practitioners stating that they in the facilities where they're currently working, the cases are increasing. And we know this is a worrying trend, because if the cases are increasing, it means the exposure is also increasing, and we need to do the right measures by putting up isolation facilities and so forth and so forth. So again, we assessed if the facility was well prepared to handle the current COVID-19 client flow, or people who are presenting symptoms of COVID-19. Unfortunately, from the findings, we can clearly see that 87% of the facilities or the healthcare workforce, the medical practitioners, say the facilities are not well prepared to be able to handle this. And further, we looked at if they were screening patients in order to assess and to look at patients who have respiratory symptoms so that they can be disaggregated and maybe taken to isolation. From this, 32% of the facilities are actually not doing this. And if you look at the case management protocol for COVID-19, this is a standard procedure that all patients have to be first screened, and those with respiratory symptoms to be either referred to a facility where they can get this particular test if that facility doesn't offer those tests, and or if the facility offers that test, then people who portray these symptoms should be tested. But 32% of the facilities are currently not doing this. So again, this is quite not good. Looking at staffing in those facilities in order to handle the patient flow, more so for COVID-19. We can clearly see that the medical practitioners stated that 54% they feel they do not have enough staff in order to handle this or particular flow of COVID-19 patient or people who are presenting symptoms of COVID-19. So again, this is not a good statistic in terms of the level of preparedness. So knowing that COVID-19 is a respiratory disease, so there's a key element in terms of the ventilation of the health facilities. And from these findings, we clearly saw that 31% of the healthcare facilities are not well ventilated. Again, this is in cognizant of that we have MOH guidelines, which talks about respiratory diseases, that all facilities needs to have natural ventilation with free flow of ambient air in and out of the open windows. So again, this is something that needs to be checked into so that all the facilities could be able to adhere to this. So on a more positive note here, we saw that most of the facilities at 80%, they have waste management equipment, which is a good thing. But now in response to COVID-19, these waste management equipment, they have to be regularly cleaned and disinfected. So we also assessed if these waste management equipment are regularly cleaned and disinfected. And what we found out is that 24% of the waste management or the facilities with the waste management equipment are not regularly cleaned and disinfected. This is in the backdrop of the MOH guidelines that these areas have to be always, they have to be disinfected always, because they can be a cause for infection or reinfection in terms of if not well handled, because we know that any waste that comes from the health facilities, it could be highly infectious. So these places have to be well cleaned, just putting in mind that the healthcare fraternity doesn't include only the clinical healthcare workforce, but we also have the non-clinical healthcare workforce, the cleaners, the administrative units, the people who even transport people with or provide transport for people who have symptoms of COVID-19. So just putting all that in mind, so there is essence of ensuring the facilities are well cleaned and disinfected, as well as the waste management areas, because there can be a cause for infection for this particular disease. We also looked at changing rooms and also cleanliness of the healthcare facilities. Again, through this, we found that 89% of the medical practitioners do not have enough changing rooms, and we know during the donning, when the healthcare workforce have to be putting on the PPEs, they need assistance, and it means they need a place where they can be changing this, and also during doffing where they can be removing this particular PPEs. So that is a key area to note. We also looked at the PPE equipment availability. Again, we found that 91% of the healthcare workforce, the medical practitioners, do not have these PPEs. Just this is in the backdrop that we know that the government has actually spent a quite substantial amount of money to procure PPEs, but from the findings that the medical practitioners do not have a sufficient supply of this, and this one is they are forced now to reuse the available PPEs, which is not recommended, especially if the PPEs are for single use. Then again, we also assessed on the trainings for COVID-19 management. As we know, it's in the guidelines that the healthcare workforce have to be trained, the frontline workers have to be trained, and even the non-clinical healthcare workforce have to be also sensitized. But from the findings from the medical practitioners, 41% of them have not been trained, and 90% require refresher training or additional training. So again, this is in the backdrop that we know that UHC, there was some allocation of money that from the UHC kitty that was provided to go to support healthcare workers training in regards to COVID-19 management. Yet from the findings, this has not happened yet. We also looked at alternative accommodation. So alternative accommodation, majority of the healthcare workforce, the medical practitioners, 96% have no alternative accommodation, and we know why this is important, for them to protect themselves and other medical fraternity, healthcare workers fraternity, as well as protecting the general population together with their families. So this is an area that we need to look into. And furthermore, we also looked at the testing. So in terms of testing, we found that the medical practitioners are stating 95% of them have not been tested. Just keeping this in mind that the medical practitioner or the clinical healthcare workforce are most at risk, and they need to be tested for them to be able even to provide services and not to infect the other healthcare fraternity. And the reason why they have not been tested, most of them cited, is because of insufficient number of test kits that were not available. On the last bit, we also looked at the incentives and motivation. This pertains the medical, the life insurance. So we know even in our constitution, according to the WHO guidelines or the standards, and also looking at our constitution under Article 41, as well as the Employment Act, we have critical issues on occupational safety and health, that each and every healthcare worker needs to be well protected. They need to be given the right components and or protective gear, and on top of that, in case of any injury or contracting any disease, they should be able to benefit from the insurance. But we can clearly see that majority of them are not insured, or they do not have the life insurance cover. Then lastly, on the psychosocial support, we saw that 82% of the medical practitioners stated they require psychosocial support. And the reason for this is they stated several reasons, but majorly was on hardship that they encountered during this time. Also, issues of stigmatization also came into play. So the key, in terms of, in our conclusion, we saw that the key issues that were coming out in terms of the level of preparedness is insufficient knowledge. The medical practitioners don't have sufficient knowledge. There is also low testing of the healthcare workers, and there is lack of insurance cover. They don't have PPEs, and there is also issues on training, that, like I mentioned. So just to part of the recommendation that we've provided based on these particular findings, we've talked about the need to be review of the Occupational Safety Health Act. That should include COVID-19 and any other disease that shall be classified as an epidemic. And so that now this one should be included in this particular act, because we are not only talking about COVID-19, but even in case of any disease that can be classified as epidemic. And there is also need to create an occupational injury fund according to the Public Finance Management Act. to cover all the frontline workers in public and also the private sectors, because we realize all these all the medical practitioners are frontline workers, so all of them need to be covered under the WIBA, which is the Work Injury Benefit Act. There is also need to develop some community strategies to guide Kenyans to access healthcare services, because we've seen, because of COVID-19, there's been interruption of uptake of healthcare services. And we know, according to our constitution, everyone has a right to a very high standard of sustainable health. Yet, at the moment, people are not accessing health services because of COVID-19. So strategies have to be put in place by the government and so forth. So we've also touched on the national budget that needs to be reviewed, and more so also accountability and transparency of use of these particular resources. Then again, we have specific recommendations for the county government. We've talked about the budget allocation to health. So they need to emphasize and they need to allocate more resources to health, and more so transparency and accountability to these resources. They also need to look at to ensure the services are available at all times, not that when there's an epidemic, then people cannot be able to access medical services. We also looked at the healthcare organizations and unions. So we talked about they need to sensitize members on their rights to health, and also to demand for compensation in relation to occupational safety and health. This is a key thing, because from the findings, most of even the medical practitioners, they do not know the channels or the mechanisms on how they can be able to raise these issues in case they have been exposed to a certain health risk. We've also talked about working in collaboration with other like-minded institutions in regards to health rights issues, so that we come up with collective advocacy measures. We also have further recommendations to CSOs, which they should work together.
Alex, sorry to interrupt you. I have to let you say you need to wind up because we have two other speakers. So please, the last slide.
Okay, so I will just maybe mention to recommendation to the UN partners and donors is that we need to ensure that we document this COVID-19, and so that it could be part of the lesson learned and how we can respond better, as well as also ensuring we have enough resources going forward. So I'm sure most of us will be able to interact further with the report and also the presentations that will be given later on. So thank you. I'll wind up on that.
Thanks, Alex. I know it was a lot of information and the slides will be made available, but also during the question and answer session, we would definitely ask people to ask us to go back to certain slides. We'll put them on the screen for those to address. Before I pass it to Dr. Mwachonda, the Secretary General, the Acting Secretary General of KMPDU, I just want to recognize Japheth Athaniso, who is here on behalf of MOH. We had him yesterday and he was very useful in responding to questions. So if you have any questions to the Ministry of Health, please post them in the chat. But over to you, Dr. Mwachonda, and then we'll see if there are already any questions for the colleague from MOH to answer. Dr. Mwachonda, over to you.
Yes, thank you very much for the elaborate presentation and for this opportunity to have this discussion on occupational, on the study that you conducted together. Before I speak, I'll just let my chairman, Dr. Roko, give some few comments, and then I can finish up on our side.
Okay. Thank you, and good morning, everyone. This very good presentation, and I want to say that we have partnered with KELIN for quite some time, and this partnership has been of great value. So this report is justifying what KMPD has been saying in terms of healthcare workers' preparedness, and more specifically, the testing of healthcare workers. So what I want to reiterate in terms of testing, we need to continue to push the government. I'm happy there's somebody from the Ministry of Health. The essence of testing healthcare workers is to ensure that they we contain the spread of this infection from healthcare workers to other patients who could be visiting the health facilities and having other conditions, not necessarily COVID-19. So before we focus on these other parts of the population, like hotel staff, food handlers, and such like things, we need to focus on testing all healthcare workers and give them priority. Number two, I want to take this opportunity also to recognize and appreciate the step taken by the government to pay for those people in quarantine and who are admitted in government facilities and they are suffering from COVID-19. That was in a big way to encourage more people to come out to be tested, because most Kenyans have been fearing that if they are positive, then they are going to be admitted and they're going to pay. And the Kenyans don't have money to pay for accommodation in quarantine or pay for hospital facilities where they're being treated. So we need to destigmatize COVID-19. Many Kenyans are fearing to be tested just because if they are found positive, the communities where they are may look at them like outcasts. So the Minister of Health and all partners need to go out there and give education to the public, tell them that COVID-19 is just a disease like another disease, so that people stop fearing this disease so much that they run away when they're being told to be tested. The government also need to improve on how they handle those of that positive. What reports where if you are found positive or you were close to a person who was positive, they come with an ambulance, with sirens. You may think you have committed a crime. You may think they're coming to pick up some Al-Shabaab person. So they need to also handle with dignity and in a calm way those who have tested positive, so that they don't scare the rest of the public to think that this COVID-19 is like the life and death sentence. Otherwise, we want to appreciate the partnership and the good report as done in partnership, and we will continue to work together. Thank you.
Yes, thank you, Chairman. I think the Chairman has been quite elaborate on the partnership we've had so far with KELIN. So essentially, I wouldn't want to reiterate much. I think the study has shown exactly where the areas of focus need to be with regards to the plight of medical doctors and the other healthcare workers. So essentially, I think one thing that we really need to reiterate and I'd like to put across is that on the issue of health workers not having adequate PPEs, is that the PPEs need to be availed as in terms of even the levels. If you look at what is happening in this presentation, is that eye protection, isolation gowns and face masks and N95 respirators. This is where the focus needs to be. I know already there's efforts towards ensuring that those who are seeing the COVID-19 patients do not run out of PPEs, but then there's the level of cares. So the level 1 and 2, that is in the triage and in the hospital environment, we're already having a good number of health workers and other doctors actually also going on quarantine because they do not have the eye protection, the N95 and the isolation gowns as the protective measure. And the more we get these personnel going on quarantine, the more we have a depleted number of doctors to handle any increasing cases that we have. The second thing is the issue of the changing rooms. I think this cannot be reiterated much further. And this is more structural, and even the county governments, we already have a collective bargaining agreement signed in 2017, 2021 that is yet to be fully implemented. And some of the issues are not being implemented. Is this issue of cold rooms, holding rooms, things that we have recommended right from the onset, even when COVID-19 was upon us. Then the other issue is accommodation. I think this is where we also have a very big gap in terms of doctors being accommodated and being offered alternative accommodation away from their homes and their families, and not just accommodation, even transport. I'm still receiving several reports of doctors feeling like they're a risk to their families. Some live with their elderly parents, some have their small children. So this is an area that the government, and we hope that both the two levels, the Ministry of Health and the county government, will act with speed to ensure that there's accommodation available for the frontline healthcare workers. And even as a matter of priority, should be the ones who are currently seeing COVID-19 patients, even as we look to expand further to the others. The issue of the incentive and motivation and testing is yet to be decentralized. It's important that we have a policy and guideline from the Ministry of Health. Yeah, of course, we appreciate the fact that they said they already launched the one at Kenyatta National Hospital as the national one. But in the counties, we are yet to have any direction on where healthcare workers can present themselves for testing, and even after testing, how they get their results and how they get further support. The insurance cover, the life insurance cover, the psychosocial support are actually key. In fact, on the psychosocial support, you're seeing that 82% required. I mean, it's a very stressful period, and we wouldn't want our healthcare workers breaking down at this critical time in this fight of COVID-19. But essentially, we do actually appreciate also the efforts so far. But one more thing and final thing to reiterate is that there is need for the Ministry of Health and the other ministry and the county governments to fast track this process of additional employment of additional healthcare workers to support the current workforce. The workforce that is currently there for the last 2 months is actually drained. They're already complaining of burnout and they're feeling extremely tired. Of course, we're aware that there's a presidential directive to hire more healthcare workers. There's funds, so the process needs to be fast tracked in the shortest time possible, and we should have them on board. So thank you.
Great, thanks both to Dr. Oroko and Dr. Mwachonda. I think it would be only fair to allow our colleague from MOH to have the chance to quickly share some reflections and try to reflect on some of the things that have come out that are not new, as our colleagues in KMPDU say, on PPEs, on changing rooms, and the aspect Dr. Roka has said, how we go to the community and pick up a person who's positive probably leaves more stigma than is desired, and that's what may be driving the fear around people. So we'll pass it over to Japheth from the Ministry of Health to have a few minutes to maybe make some remarks on behalf of the ministry, and also to see what are some of the quick points you could raise, and then we take more questions from colleagues on the call. And if there's any journalists, please post in the group and we'll give you a priority. Over to you, Japheth. Thank you.
Yeah, thank you. Thank you very much. I wish to thank the presentation, Alex. Thank you, Dr. Mwachonda and Oroko, have received your sentiments. However, let me start by the issue of mass testing. Ideally, you realize that in general, we have two levels of government. We have the national government and we have the county government, and both governments have got selected budget. For example, the healthcare budget in Kenya was around 62.7 billion. However, from the presentation, there's also need to also supplement this budget so that it may help activities at the county level. In the issue of testing, we already have designated sites and areas whereby different parts, different regions can go and get testing. Different healthcare workers can go and get testing. For example, we have National Influenza Center, which is in Nairobi. We have KEMRI Nairobi. We have CDC KEMRI Kisumu. We have Wellcome Trust KEMRI Kilifi. We have Aga Khan, and we also have Wellcome Trust in Kilifi Laboratory. And the counties have been advised on specimen referral. Okay, so it's not an issue of only the public mass testing. And this was instituted in March, mid-March. Okay, we are now in May. And as at that particular moment in time, we were also moving towards now increasing the capacity of testing. So all Western and Nyanza and South Rift counties were sending all their specimens to Kisumu. We prefer sending of specimens at that particular moment in time rather than sending the healthcare workers to the facility. And remember, going for testing is voluntarily. You're not coerced and it's not mandatory, not unless there's a legal action and it's something of a great concern. So there's no way the national government can come down to the county government and to the sub-county health facility level 3 or 2 for that matter to force a healthcare worker to go for testing. Then it is the work of the county to actually sensitize their counties, sub-county MOHs, and to the county community health system or health strategy, okay, to know where they're supposed to go and get tested. So as much as we may want to say they have not been tested, yes, they have not been tested, but question is it an issue of knowledge, attitude, and practice, or is it just an issue of misinformation or communication from the different levels of government, especially the sub-county level? We also have the coastal region, because the presentation was made from the coastal region perspective. All coastal region counties send specimens to the Wellcome Trust Kilifi laboratory, and this was in 24th March. We are in May. So by now, there are even more distributed centers for testing in the coastal region. Mombasa right now are currently doing it, and in March, they were not doing it. Then we also have the North Rift counties, Narok, Kajiado, Makueni, and etc. They were all being taken to Cambridge, Nairobi. This was as per March, mid-March. But however, before the curfew, Machakos County, okay, was also licensed to help do mass testing, especially for healthcare workers first, because our priority is the healthcare workers, because there's no need of neglecting the healthcare workers, knowing that the burdens of NCDs in this period of COVID and communicable diseases are also on the rise and the increase. In the issue of facilities being whether they were well ventilated for respiratory illness and etc. Ideally, you quoted, if you go back to that slide, you quoted that, yes, that one, go back. There's a quote, not that one, the other one, where the MOH recommendation guidelines, that one, that according to MOH guidelines on respiratory diseases, the facilities need to have natural ventilation, free flow of ambient air in and out. However, if you review the current guidelines for COVID that were released in March, early March, if you go to the website for MOH, tab COVID-19, the resources, you'll find more than 100 guidelines. There's an updated guideline that needs to inform this presentation. Ideally, they recommended for isolation and quarantine areas for respiratory wards and centers. And respiratory condition is basically to have a negative pressure room, because we have positive pressure and negative pressure. Apart from free flow of ambient air, we need to have negative pressure whereby there is more air coming in, and then there's a circulation system, maybe an AC or a fan and etc., that now directs the circulation system inside to going out, because the air is composed of not only oxygen, but also carbon monoxide and others. So when there's more inflow of free air, it creates a negative pressure. Hence, this can easily help inform your study and the sensitization of healthcare workers. The other challenge is that issue of insufficient knowledge. It's so evident because ideally you find that healthcare workers, it takes time for them to update their books. And it is the work of the different associations, Kenya Medical Associations, Kenya Clinical Officers Association, Nursing Union Associations, and other associations to ensure this issue of knowledge, sensitization, and awareness of a simple thing like negative pressure in a simple isolation ward for TB or respiratory illness. The national government cannot come down to the sub-county government, okay, to start training, yet the counties, through the Council of Governors, highly emphasized that health is a devolved function. So we as the national government, we can help institute, bring policies, guidelines, give directive, but down at the sub-county level, it's up to now the county government through the support of the national government and other private-public partnerships to help sensitize and train the healthcare workers. Because sensitization and training are two different aspects. One is long-term, the other one is short-term, and the method and duration also varies. Then we also have this question of compliance and enforcement, whereby the rapid response teams that are going to get a patient who is suspected to have COVID or a patient who has COVID or a response. It was mentioned that they go in with sirens, they scare the community members and the neighbors at large. Well, I'd like to say that these RRT response team, it's an aspect of a multi-agency team. It's an aspect of a multi-agency team. So actually, the issue is we are not working alone. So the fact that we are not working alone, we are working with security officers, law enforcement officers, whom actually do not have training on patient management and others. We cannot go in without having an enforcement area, an enforcement backup, because the police officers are the ones who help us go get these suspected patients who are actually some of them are hiding. Okay, so by the virtue of the fact that they are hiding, there must be some law and enforcement. And then once the patients are the suspects, we have them, our surveillance team go inside, they take swabs and etc. So by virtue of that, you realize that it's a multi-agency. And by the time the knowledge a medical doctor, clinical officer, or a nurse has is totally different from the knowledge, the language. Someone who's used with the military personnel knows a totally different language, law, and order. Well, there's also this issue of the human resource for health. Well, the capacity for healthcare. Hello, can you?
Japheth, you're coming in and out. Could you just confirm you're still there?
Yes, I am there.
Okay, proceed.
Now, there's this issue of the human resource for health. Well, the national government, actually, we as the MOH, we actually emphasized the gaps whereby there is need for adequate healthcare personnel. And remember, when we talk about the healthcare system, we talk about everyone from the nurse to the janitor, to the cleaner, to the head of IPC, to the public health, to the laboratory technician, to the doctor, to the supply chain management. All these, they take into account for human resource for health. We wanted to employ healthcare workers who will be segregated, who will be taken to the counties, depending on the need within the counties. Specialities, medical specialities, because some counties are even sharing medical specialists. However, just when we were about to undergo the issues of shortlisting and recruiting, through the Council of Governors, counties stated that health is a devolved function. Hence, there is need for them to recruit their own people. So through the public service, all the applicants who had applied through the system had to be segregated based on their respective counties, so that the public service commissions at the county level need to take initiative to do shortlisting, interviews, and select their own. So as far as Ministry of Health is concerned, we have no mandate to go into a devolved function and carry out their functions down at the sub-county level. It's like a chairman of an estate going into the affairs of a neighbor's house on how they are going to employ a watchman and a house help. It is next to impossible. But when it comes to the issue of Nyumba Kumi initiative, that is when the chairman can represent that estate at the national level. I hope I've addressed all the concerns that has been raised. If there's any I've left out, please feel free. Thank you. Hello.
Japheth, I'll allow you to have a breather, but we have carefully listened and other questions have popped up. So just look through the chat box and we can paste the questions again. There are questions, just you don't have to answer them now. We'll give you a breather. Where questions about what does mass testing and targeted testing mean? There are questions around from our colleagues like James Kamau. First of all, from Christina Julu, my question goes to MOH. Ever since we've had the first confirmed case, we have inadequate test kits. Right now, we have rolled out mass testing. What are the sustainability mechanisms? Do we have adequate kits? So yeah, just have a look at the chat box. But in the meantime, I want to turn back before I allow Fenwick to answer his question. I just want to alert Dr. Mwachonda, Dr. Rock, and any other KMPDU members that are here around the concerns raised by Japheth, and in terms of the points are there for testing of healthcare facilities. Is it that the fear, knowledge, or practice that is making your members not want to go get tested? What's the concern around there? We have been told that there are guidelines on the website. Do we have access to these ones? How often does the ministry update them? And again, part of this multi-sectoral response in evacuating a person suspected to have COVID in the community, again, how do we address some of these issues? So as Dr. Rocco, Dr. Mwachonda, and their colleagues think through that, Fenwick, could you pose your question? And then we will come back to the KMPDU team. Then we'll come back to Japheth, and then we'll start winding it up. So Fenwick, your hand has been up for a while. Please proceed to quickly make your comment or question. Please really keep it brief and to the point so we can have further discussions. Thank you.
Okay, thank you, Alex. Good morning, everybody. Yeah, my name is Fenwick Mudanja, Chair of the National Association, Clinical Anesthetist, and I'm actively practicing anesthetist at Kenyatta National Hospital. My question goes to interaction of patients within the operating room. I think the best international practice is that once you are faced with a patient who is confirmed positive, when it comes to his or her documents, you are not supposed to handle any, and probably you're only supposed to take a copy and the others are supposed to be discarded. And from our perspective as anesthetists, we know that documentation is very key and we have to keep these records. Now I want to pose this to my brother from the MOH, Juan Atanasio. What is the ministry's guideline on management of records in as far as COVID positive patients are concerned? And number two, you talked of negative pressure areas. Could it be the consultation rooms or operating rooms? But I've noted in most of our operating rooms, we don't have the pleasure of external air coming into our operating rooms. Maybe what are your comments on that? Thank you.
Thank you.
Just hold on. I want to allow Angela Nyakundi to speak. We haven't had a lady raise any concerns. Angela, please. Angela, if you're speaking, your mic is muted.
Sorry, I hadn't realized that. Sorry, good morning.
Good morning.
Morning.
Go ahead.
My name is Dr. Angela Nyakundi. I work in the Ministry of Health, the Division of Human Resource for Health. I'm sorry to be joining the meeting late. We did have a meeting preceding this one. And therefore, I may have missed some of the concerns, particularly relating to human resource for health raised by various participants, although I do know my colleague Athanasio has been handling the queries very well. So for the minutes remaining, I'm available for any pertinent questions. Thank you.
Thank you, Dr. Nyakundi. You've just come at the right time, and I'm sure the colleagues from KMPDU will have something to say. So I want to pass it on to Mwachonda, Dr. Rocco, and any other KMPDU member to try and address some of these concerns, but also just on my part, Japheth and Angela, I know you have clearly and carefully navigated the separation of functions between the national and county governments. But our question on our end would be for the facilities you're in charge of, including the ones now under the Nairobi Metropolitan, how do you address some of the concerns of PEPs, of enough workforce, and everything being in order, because that now squarely is within your function. But over to the KMPDU colleagues first.
So I'll once again just let the chair speak and then I can finish.
Machanda, proceed for now, just.
Yeah, so I've heard the sentiments of Dr. Japheth, and I understand to some extent his perspective from the national level, and we were also hoping, and I think Alan will bear with this, that we were hoping that the county government would also be part of this brief today, and it seems they've not been able to attend, or rather they did not attend. But what comes out, and this is where I think we've always had challenges in the health sector since this devolution, is that this level of coordination, though it's in the constitution between the two levels of governments, has always been marred with conflict. And now you can see how much it is affecting the response to COVID-19. And we're in a situation where we don't need the conflict that is there, because even on the issue of employment, already you've had the clarification that county public service boards want to employ. And so far, there's been no movement on that because of that conflict. If you come to the issue of testing, I think the only challenge that I'd say is that, the Ministry of Health has come out public on so many issues. One of the issues that they came out really strong and public on the issue of testing availability at the national level. But you see, as a ministry, there is as per the fourth schedule of the Constitution, there is that obligation to give the policy direction. So as direction, it's important also that the direction on testing and this availability. I'm aware of the labs that are actually being available in the counties and in the regions, but unfortunately that came out as lab availability for the masses and not for the healthcare worker. So essentially what you mean is this healthcare worker who is supposed to offer services then wouldn't be given priority testing at that point in time, because when there are other members of the public being tested, then it means you just have to go through that, which is very different from what is happening at KNH here, where the healthcare workers are being tested on priority basis as opposed. So it becomes also difficult for a healthcare worker to go and queue for so long and for testing. So essentially, yes, the Ministry of Health has tried its best, but then this link between the ministry and the Council of Governors, or rather the county governments, this relationship at some point needs to be made clear in terms of coordination. So then now we have an ease of all these things. Remember, these findings are coming from the doctors on the ground. It is not even, KMPDU has members. So the questionnaire was sent out there, and it's the doctors on the ground who filled this questionnaire. And that is the feedback that we have as a report here, both for us as KMPDU and even the Ministry of Health. So I think the Ministry of Health should now take this, and now within that forum of consultation and coordination between the two levels of government, put it out there clearly that county governments need to take step A, B, C, and D on testing, on PPE's availability, on changing rooms, on all these issues that have actually been raised in this study.
Thanks, Chair. Rocco, do you have anything to say?
Yes, I have something to say.
Please go ahead.
Especially on the human resource aspect. Our colleague from the Ministry of Health has rightfully said that the recruitment that was initiated by the national government was a bit hampered by the disagreement. So as a union, and this is what we've been saying over time, and we can clearly see that there is a pandemic, and we have had pandemics before. So as a country, we need to be more prepared for future problems, because nature, you cannot predict nature. Anything can happen without any particular notice. So in terms of preparation and proper coordination of human resource recruitment, deployment, and the posting and all that, we need to have a centralized body which coordinates all this process, so that we remove this misunderstanding and confusion that seems to be existing between the national government and the county governments. And that's why we have always proposed to have a health services commission, which then is responsible for recruiting and deploying healthcare workers. So we could not be seeing this confusion that is currently in place. And this commission will ensure that there is adequate human resource, because the county governments, as they are, they're not focusing on the guidelines provided by the MOH on staffing norms and the standards. So if we can achieve the staffing norms and the standards, we could not be struggling to get emergency money to recruit healthcare workers at the time of need. We should be having all these workers in place, and when there is need, they continue to do that particular work. So that's what I would like to say, and I say that as KMPDU, we continue to push for HLC creation through the amendment of the Constitution, and we call upon our partners like KELIN to continue advocating for this, because it is very important. And this pandemic is even a clear manifestation that we need that commission. Thank you.
Thank you, Dr. Rock. I know we are pressed for time, but both for Japheth and Angela, I have the following rough questions on the list. James Kamau has talked about, do we have, why not take an approach where we have a facility where healthcare workers would stay? Again, we'd want to hear your thoughts on that. I'm sure you limit them to the context of the national government facilities. We have Hillary, who's talked about testing of frontline workers. Again, he wants to know where we are on that. Christina Julu is asking whether you have enough test kits. Pamela is asking, as Wanjiku, what's the difference between mass testing and targeted testing? I think Fenwick posed some questions around guidelines, which you are able to capture. And I guess you've had some of the responses. So on the side of the ministry, Angela and Japheth, over to you to try and address some of the questions, and then we will wrap it up. Thank you.
If I could go first, perhaps on the queries that have a greater link to the human resource. I am grateful for this meeting first, because first and foremost, I'm a health worker. And so the colleagues you're talking about are my colleagues, my friends, and I mean, really, Kenyan citizens, so to speak. And we really appreciate the feedback, because then it tells us how better to plan for this pandemic. And not only for now, but even going ahead, what can we do better? How can we strengthen our health systems? And my colleagues, Oroko and Mwachonda, have raised queries that actually have been in discussion since the pandemic began, regarding the PPEs, regarding testing availability and accommodation, some of which the ministry has been engaging other ministries, such as the Public Service, Ministry of Labor, on being explicit about how to protect our health workers. We have also been in discussion with the counties, wherein we, even as these discussions are being had, we are actually saying that these things actually need to be put into consideration. Please have these presentations be made to the Council of Governors, to the CECs, to the chief officers, so that plans can be made, so that, for example, like for the PPs at national government, we are working, for example, for the isolation and ICUs, as we project possibly the numbers, to forecast the number of health workers that we would need, and therefore possibly hand over and advise the PPs that we would need, and also trying to establish a communication mechanism with the county to then advise, as the documentation is going on how to forecast their needs, so that not only can we plan to get the PPEs, but how can they be efficiently used. As regards testing, the same numbers and advice we're giving is what we're trying to use to advise the teams that are doing the procurement to plan for the testing kits ahead. So as the Division of Human Resource, we are working very hard to do it in a scientific manner so that then the planning is ahead, not by day or by week, but really to plan ahead so that we really learn from the other countries that have gone ahead of us in this pandemic and in the terms of their curve. And I can actually say we've really been trying to engage with the county level or the staff who's being seconded to the HRH function, pandemic function, to work on what we can do better. How can we better engage the counties in terms of capacity building? What are challenges the counties are having as regards HRH? Are they aware of the measures the ministry is taking on testing, on welfare? I even understand, I did come in when we were discussing about psychosocial support and how perhaps they feel it is wanted. The channels are there. Perhaps we'd like to go, we'd maybe work through the unions and the associations to tell us specifically, is it, as you say, a lack of awareness, as my colleague was saying, is it a lack of awareness? Is it maybe that some of the resources available are also accessed at a charge? Are they not aware of the toll-free numbers? So that when we make this available, or would they like perhaps physical presence of, say, a psychologist or a counselor? And therefore, I may not be able to comment on some of the propositions like the HSC, but in view of time, maybe this is what I can say for now, because actually outside of this meeting, we are continually engaging with all associations associated with HRH in the Kenya. Thank you.
Yeah, thank you. Thank you, Angela. Can you all hear me?
Yes, we can. And maybe, Japheth, I know just before
Yes.
you want to note that Francis Otinga asked a question that Angela may respond to in a minute when you're done, asking whether the Public Service Commission has forwarded the latest application.
Okay, thank you, Angela. I'll tackle the issues that hasn't been tackled yet. In regards to my colleague Fenwick Mudanga, the chair of the National Anesthesia. Well, the issue of patient management of COVID-19 in terms of records and record keeping through the Kenya Health Professional Oversight Authority, which actually encompasses that brought about the Nursing Council, the Clinical Officers Councils, and the Kenya Medical Practitioner and Dentist Council together in terms of coming up with guidelines. Yes, we have guidelines on patient management and record in the nursing cardiac care in regards to COVID-19. And we also have the ones for documentation on patient treatment management and activities on a day-to-day activities from day one of admission to the discharge day. So if you look at the Ministry of Health website, there is a column for COVID, there's a tab for COVID-19, and it has more than 100 resources. In the event you do not find them there, you can just inquire from KH4 offices, Kenya Health Professional Oversight Authority, so that they may actually give you some of these guidelines. Thank you.
Angela, do you have any quick response on the question by Mr. Francis Otinga? Have PSC forwarded the latest applications to the counties?
I'd like to...
Chonda and Aroko to give their remarks. Over to you, Angela.
Sorry, to Francis. I would need to liaise with the Director, Human Resource Management and Development, because we do give, the division does give way in on the technical aspects of the cadres and the numbers required. Then the actual facilitation of the hiring is through that director who liaises with the PSC. But we are all aware that there is urgency and that the Office of the Cabinet Secretary is really supporting the rapid hiring as directed by His Excellency the President. Thank you.
Thanks, Angela. Over to Mwachonda and Rocco to give their closing reflections, and then we shall pass it on to Alex to give his quick reflections from what we've had, and then we can call it a day. Over to you, Mwachonda and Dr. Rocco.
So I think in closing is thank you for this opportunity and thank you for partnering with us on this study. But more importantly is that we all need to work collaboratively. I think the issues that have come out from these are issues that can be handled quite well, and eventually, so that we align ourselves on all, I mean, the government, the sector unions, the associations, so that once we are all aligned on the same place, then we'll be better placed to combat this pandemic that is upon us. And so essentially, we are open to further collaborations, and our two colleagues here from the Ministry of Health can keep doing the good work that they're trying to do. I think the only challenge that we have that is coming from this now is the county governments also are not coming out strongly on some of these issues, and so perhaps then we need their support, the support of the MOH. We are willing to support MOH to make sure that counties also step up on the measures that need to be taken. Thank you.
Thank you, Machanda. Rocco, anything?
Thank you, Alan. Mine is to thank everybody and say that the MOH are doing their best. I was expecting to have, we have county governments in this discussion, but unfortunately, again, it's the gaps which we've been talking about. Hope moving forward, then we can have proper coordination at the two levels of government. But still, the answer remains one center of command down in terms of HRH and all issues dealing with health. With this confusion, then things can get worse with time.
Thank you so much, Person. Alex Mudui, any quick reflection?
Yeah, just to appreciate everyone for participating in this call, and just to highlight, we are going to share these findings in the next 2 hours. We'll share the presentations, and I'm glad that through the evidence that we have, we've clearly heard from the MOH that these findings will also be shared to the CEC and the COGs, so that we can be able to promote evidence-based decision making based on what is happening on the ground. So for me, it's just to appreciate each and everyone who participated, and we look forward to continuously working with you.
Thank you very much, Alex. And on my part, on behalf of KELIN and on behalf of KMPDU, our partners, we are grateful to Angela and Japheth for stepping in for the Ministry of Health. We appreciate your responsiveness, and please do communicate our appreciation to your leadership on this. We did invite the county governments, and we will follow up with them. We have actually raised some of these things on social media, and we shall explore whether we can get another session where we bring both the colleagues from KMPDU, from the Nurses Association, from the Clinical Officers Union, together in a webinar, and we have a structured conversation to either pick one of the topics. It could be PEP, it could be human resources for health, it could be guidelines, and see whether that would be a possibility to have a comprehensive conversation. But as colleagues have said, we're in this together, and we need to find a way out of it and see how this can help strengthen the health sector. So on behalf of KELIN, thank you all for joining. Thank you all for your contributions. Thank you all for your questions. We shall keep the conversation going, but our ultimate goal is to win the war against COVID, but in the process, ensure we strengthen our health systems. Have a good afternoon and have a great weekend. And as MOH should say, wash your hands, wear a mask, and stay at home. Thank you. Bye-bye.
Bye-bye.